So, hi everybody again. This is Vaughn from the Oakland County Democratic Party, and we're here today with State Representative Mari Manoogian, who is a friend of mine, uh, Armenian. So, hey,
Yes.
yay,
Hi, Maud. How
Armenians!
are you?
I know we're not prejudiced at all or anything, but this has actually been one of my favorite things to kind of keep myself occupied, and I hope some of you out there are enjoying it as well. These interviews that we're doing. Stay up to date with us on our website, ocdp.org. Like our Facebook page, or just check for our YouTube channel, Oakland County Democratic Party. We have all these videos are up there. There's still some really useful information that you can use if you're trying to apply for unemployment or worried about health insurance. But I want to just jump right in with Mari. And again, as I always like to start with, how are you? How is your family doing as we're all kind of hunkering down to get through the coronavirus challenge?
Everyone's doing well. Thanks so much for asking. We've been, keeping busy by doing a lot more home cooking. And every once in a while, I'll make something and drop something off at my parents' house on their doorstep, so they're able to have, fresh bread or whatever it is we're making over here. And keeping really busy with checking in with our constituents as well. It's been, obviously a very trying time for everybody, but trying to make sure that we have a good schedule and still able to work out and do all the things that try to keep everyone kind of back in their routine has been really helpful.
Yeah, I think one thing that I feel like a lot of people aren't really taking into account is how much constituent service you and some of the other not just state reps but congressional reps have been having to do, because we all got dropped into this really weird situation where we had to navigate all these systems really quickly. I don't know if you saw this note, but there was a shipment of medical equipment, and I want to say that it was being brought in, and the only reason it wasn't diverted at the last second by the FBI is that the person that was bringing it in, the medical administrator that was bringing it in, reached out to their congressional rep and had them step in and kind of help let them know this was an official shipment and not like a black market drop.
Exactly. Yep. I saw that online as well myself. And, all the work that everyone's doing at the federal and state level to make sure their constituents are able to access their unemployment benefits, make sure that small businesses are able to take advantage of the resources, however limited they may be at this point, from the federal level. Everyone's been really stepping up and doing a great job. I mean, in the first couple of weeks, we had over, just on the issue of education alone, we had received over 1,500 emails from constituents across the district who were concerned about the future of their child's education during the pandemic. And we were able to respond to every single message.
I mean, that's incredible. And I mean, I commend you and your staff for being able to deal with that. And I know you and I actually had, been friendly with each other. We're not good friends, but we're friendly.
Hey, we're Armenians.
Yeah.
Armenians stick together.
Well, also Armenian Democrats. So
Exactly.
like doubly rare. But
Exactly.
you and I had a chance to talk to each other before you were elected, when you were running for office. And I think it's really important to kind of let people know, this isn't what you ran for office to take care of. It's not what you were thinking you were going to be dealing with once you got elected. So tell me a little bit, what's your personal perspective? How do you feel about what's going on right now as a state rep?
Yeah. So the first thing I will say is, while no one runs for office assuming that a pandemic will be on the horizon within the first 8 months, I firmly believe that, all of us are in a position to help our constituents for a reason. I decided to put my name on a ballot almost 3 years ago because I felt that I was in a position to be able to help our community in the ways that I know how. And that's, making sure that folks are interconnected and that they're able to get any sort of resources they need to live happy, successful, fulfilling lives. And, to take that a step further, during situations of crisis, it's important for our leaders to model good behavior and to help basically cut through the red tape of getting access to any of the help that folks need. And so, for me, that's a really important part of leadership, is being calm and having resolve in the face of a crisis. And I'm really proud of our office for handling it and modeling good behavior.
Yeah, I mean, again, being able to be there for constituent service is one of those underrated parts of the job that, it doesn't require you to go to Lansing. It doesn't require you to, do anything big and flashy. It's just being there and answering people's emails.
Exactly. And making sure folks are able to know that they can expect a call back from us, or that we're going to go and do the research that we need to do to be able to help them through their case. And being reliable, and that they can expect a call back from us. That's something that is, completely, I think, undervalued, and people don't necessarily think about it until they or their loved one needs that help.
Yeah. So let me ask you a question, because we're on April 20th right now. So we're kind of, just to give everybody a sense of date and time. And we're not quite a week out from the Operation Gridlock protest that was in Lansing last week. This has been a really emotional it's an emotional topic for a lot of people. But let me ask you a question. Were you in Lansing last week? Did you have a chance, or do you know anybody who was in Lansing? Did you see it personally, or what's your take on the protests in general?
Yeah, so I was not in Lansing. The House was a no attendance, no voting session, and so I was not required to be in Lansing. And per the governor's executive order, if although I'm considered an essential employee because I'm a representative and I have a constitutional duty, if I did not have to be present or I did not have to leave the House, I didn't. And so, I followed really closely online, and of course was in very close contact with the representatives who do represent the Lansing area, who were on the ground there where it was happening. And frankly, the comments I've heard from my good friend Sarah Anthony, who's the state rep for the Lansing area, was just that her constituents were afraid and very concerned. The fact that the protests brought traffic to a halt in many of the major thoroughfares throughout the city was very concerning, not just to the representative, but to folks who are, for example, administrators at Sparrow Hospital. Concerns that folks weren't able to get emergency vehicles, be it a fire truck or an ambulance or anything of the sort, to their homes in a timely manner. That's just simply unacceptable. I'm of course supportive of folks' right to protest and their constitutional right to assemble. However, when it comes to public safety, seeing news footage of adults without masks or gloves handing out candy to children, I was really just disturbed to see these images. That people who should know better, there are adults. They are people that should be modeling good behavior for the young folks in our area, in our state, just simply not doing that. And that was something that was, honestly, it broke my heart.
Yeah, I think I had a friend of mine that was kind of rebroadcasting a live stream from the event. And I think they were at a weird friction point where, I know I've said this before to a couple different times, but there's really like two windows on this virus. And there's the people that are saying, this isn't a big problem. We don't need to be worried about it. Don't worry. It's not a big deal. Everything's going to be fine. And then there's the people that are kind of on the other side who are always saying, boy, we really wish we had taken this more seriously a few weeks earlier.
Yeah, I think the one other thing I want to add here, and this may be too pointed, but at this point I don't care. I am incredibly disappointed in my colleagues from the other side of the aisle who were active participants in an event that they knew was going to cause a great deal of risk to our local communities. And not just active participants, but we're egging on the protesters. And in fact, we're organizing the event. As we know, Representative Maddock and his wife were ringleaders of this event. And to put our communities at risk like this, where there is such a risk of community spread, when we are just now seeing evidence that the social distancing and mitigation measures that we are taking are starting to work. We are seeing a flattening of the curve. It is a very difficult time. We all understand that, but to see that we just are now seeing glimmers of hope, and in my heart, I really truly hope that protest is not a catalyst for another 100 cases or more. because of the potential for spread, given that there was such a high volume and high concentration of people in that area that day.
Yeah, I think just speaking personally, one of the things that I was really worried about for myself and my family is that one of the last things that we did before the lockdown really hit was we went to the Joe Biden rally that was at high school in Detroit. And it was that, it's the sort of thing that you don't think about at the time. You can't think about it at the time that, when we were doing that, we weren't thinking like this is going to be a massive, community spread risk. But we were really worried about it for a very long time afterwards, especially my parents are both older. They're both in their 70s, so they're high risk for this disease. Um, and I think it was one thing to have that sort of event and do something like that when we didn't really fully realize the risks of the disease. And I really do feel like it has to be, there's a different level of it, or there should be a different level of it now, as we're kind of, we should be worried about community spread, especially in places that have very little capacity to treat any kind of an outbreak. We have a big state. It's very, oftentimes especially those of us in the southeast corner, we tend to forget how big of a state this really is. And if people came from, up north and came down for this rally and then went back home, there's a very real risk of community spread in those areas.
That's absolutely right. And it's one of the things that we've been hearing as representatives from the beginning of the pandemic, which is, while we're seeing our Southeast Michigan hospitals overloaded and with a lack of PPE and all of the resources they need to treat all the folks who are coming in with this virus, we are also very deeply concerned about the lack of resources for our rural hospitals. The issue around support for our rural hospitals does not just exist during the time of COVID-19. This is something that has been an issue for all of us in the legislature. It's something that we look at very closely when we do our budget every year. And not to digress too much, but one of the things that we've known that this is an issue, in particular for the area of OBGYNs and childbirth, having a lack of access to adequate medical treatment for pregnant women in particular in our rural counties is a huge issue. And so if you think about it, this is not just an issue related to COVID-19, and all of the municipalities in these rural areas have been sounding the alarm and have been very concerned about community spread in rural areas because of the distance, simply the distance that someone would have to travel in order to seek medical attention. And just the lack of beds and supplies they would be able to procure, and how quickly they'd be able to procure them in a time of crisis like this. So everyone from the mayor of St. Ignace has even spoken to the AP a couple weeks ago, specifically saying how concerned they were about about people coming from downstate and traveling up north to a second home or to renting an Airbnb, whatever, what have you. Concerns about migration into these rural areas where the disease wasn't as prevalent, and having that community spread be an issue. And I know some folks are saying like, oh, I can just go up north. I'm just going to come up to my cottage. It's not a big deal. But let's think about this. If you stop for gas along the way, let's say maybe once or twice during your trip, that's already 2 stops that you've made. Let's say there's no food in your home up north and you have to go to the store to go get food. Let's say you decide you wanted to get pizza carried out. So that's another stop that you've made. You've already made at least 4 interactions in a community that may have not had an interaction from someone from Southeast Michigan that day. And all there needs to be is one incident of someone catching something that you may be shedding unknowingly because you could be asymptomatic and spreading the disease. So this is something that we followed really closely.
I think there's a kind of a strange amount of irony in how, when we were first looking at the community spread issue, one of the things that we saw was people from communities up north saying, don't come up here, don't just run up here for a vacation because you could be bringing stuff up. And then we have this event where people from all across the state all came down to Lansing and then went back home. So there's a weird kind of a hook there where, it was very accurate. People should not be just going up north for, pleasure days or whatever, going up to just kind of get away from the sprawl. But then also, we have to recognize the other side, that the people that are in those communities should also be trying to sort of limit their interactions with other large groups of people.
Yes. And I mean, I will say this. I've been incredibly frustrated by the amount of doublespeak that has happened over the course of the pandemic, where on one hand, the governor isn't doing enough to keep us safe, and then she extends or expands an executive order to fit with the most current CDC guidelines, or to ensure that Michigan is taking the most stringent steps to ensure that we are not spreading the disease, given that we are third in the nation for death toll, even though we're the sixth highest in terms of infections. And when that happens, then all of a sudden it's too much. And it's just it just shows to me that this is not about health, public health. It's about politics, and that's not how it should be during a time of pandemic. I've seen constituents, it doesn't matter to me what their political affiliation, their age, their ethnicity, their gender, people are stepping up to help one another. And that is exactly what we should be doing during this time. And spreading misinformation or riling people up for no reason, it's really disheartening to see that happening. And I'm really hopeful that, as we move forward into this sort of new normal that we're existing in, that this is no longer the path that people are going to choose to take with regard to communication.
Yeah, I think one of the things that as I've been dealing, responding to people who are commenting on our Facebook page, one of the things I've seen a lot is people who want to complain about two things. They want to complain about the restrictions that are like keeping them from doing the things that they want to do. But then they also want to complain that there aren't more restrictions on things that other people are doing. So it's, you never hear somebody who's like, oh, I think I should be able to golf. And also everybody should be able to do whatever they want. It's always like a partner thing of, I should be able to go golfing. And also I don't understand why, liquor stores are still allowed to stay in business. It doesn't feel like there's a principle at the core of it other than just sort of, I don't like it when people tell me what to do, but I definitely think that I should be able to tell other people what they should be doing. And that's
and it's been an interesting thing to see. However, I will say that by and large, the response in our district in Birmingham and in Bloomfield and West Bloomfield has been largely positive. There's obviously some elements of this that are incredibly frustrating, but this is the thing I would say to my constituents and to anyone who's listening regarding this issue is, of course, this is incredibly frustrating. During this time of year, I love being outside. All of us love either going out boating or golfing or doing all of these lovely things that, our beautiful, pure Michigan provides for all of us. Also, during this time, my staff and I like to be knocking doors. It's no fun to be on the phone constantly. And it's something that's, a challenge for all of us. And I know that all of our constituents, whether they're small business owners or their parents who are dealing with this new reality of homeschooling their kids, it is incredibly uncomfortable for everyone. And we want to be able to get us back to a semblance of what our reality was pre-COVID as soon as possible. But the only way we're going to be able to do this is if we do this and we make these decisions rooted in facts and in science. I've done a lot of reading over the past couple of weeks, and one of the things I've looked at really closely is how countries responded to the 1918 Spanish flu pandemic. And there were countries that decided to open their economies very rapidly after the first wave hit. And unfortunately, the second wave of the virus was incredibly detrimental to their economic stability. And that's something I want to make sure that we avoid here in Michigan and across our country. I want to make sure that we're making these good decisions so that way, when invariably there will be a second wave, it is very, very likely that that's something that could happen here, given the timetable we have for creating a vaccine and for ensuring the public is able to be inoculated against the disease. We need to make sure we're doing the right thing here, both with regard to public health and the economy.
Yeah, I think one thing that I've seen kind of bouncing around as people are starting to talk about reopening the economy is the idea that, if you've had it and, recovered, that you're immune. And that's not something that we know for a fact yet. We really don't know. There are some viruses that exist right now that if you contract it and you're sick and you recover, it actually can increase your risk for other similar viruses. And so we really don't have, we only have, I think, right now, maybe 3 months, maybe 4 months of really good data on how this virus responds to the population. And I think it is really premature to start making assumptions or trying to take action based on things that we assume but don't know for a fact. It's possible that none of us will ever develop natural immunity to this virus. We don't know. We just don't.
So the thing that I would say that we would need in order to set up a plan for what a quote economic reopening would look like, we need more testing. We do. We need more testing at the point of infection. We also need more testing with regard to antibody testing. So we know who in our population is able to resist a second bout of this illness. There are just the fact that there's just such a lack of testing available in the state of Michigan is something that's going to slow us down when it comes to being able to re-engage our economy in the way that we want to. And that's the thing that I think is most important is any serious plan for reopening the economy needs to include how we're going to procure enough tests and how we're going to test our population.
Yeah, and I think actually when Dave Coulter and I talked last week, one of the things that was, and I'm going to be honest, it sucks and it's not fun, and I don't like talking about it or thinking about it. But this is not a situation where we're going to have one day on the calendar where we're going to put a pin in there and say like, okay, on this day, everything just reopens.
That's right.
Every step of this is going to have to be where we phase up and see how things go, and then we kind of make an assessment from there. And at some point, the thing that actually was really upsetting is like, we might never have an opening day for Tigers baseball this year. And I know, it's a small thing, but still,
it's a huge thing. And I say this like as a lover of sports myself. As you can see, I've got a Chauncey Billups behind me. I always loved Detroit sports. And, the thing that's so difficult is when we think about huge events that have happened in American history, whether it's in times of war, for example, during the aftermath of 9/11 or the aftermath of Hurricane Katrina or any of these major disasters or terrorist attacks in our country, we have all rallied around sports. Whether it's, President of the United States throwing out the first pitch at a baseball game or just being able to sit around the TV and catch a game of football. It's something that is a constant in our lives. And whether you're a sports fan or not, it's something that you have a friend or a family member who is a huge fan of any team. You just have to know somebody who is connected to American sports in that way. And this is a great example of just how difficult that this pandemic has become, where folks are having, folks are not able to have that one cultural connection that keeps everyone connected together while we're in our homes and separated from one another. The one thing I will say is like last night I was glued to ESPN's brand new documentary, which they actually moved up because they knew people would be in their homes. It was supposed to premiere in June. But the new documentary about Michael Jordan, it's a 10-part documentary series that's been years in the making. And just to see how many people on Twitter were like tuned into this, people that I didn't even think were sports fans were watching it. And I think it's just a cultural moment that people want to be connected to. And it's really hard to get people to understand what this reality is. And it's a huge challenge. But we're Americans and we're resilient. We're already starting to do these things where we are creating these moments for our communities online for us to stay connected. And they may look a little bit different for a while.
Yeah. I think, my family and I did the Disney family sing along.
Yes, I saw that as well. Big fan of Disney.
Yeah.
So.
And that they were saying that had the highest ratings of any program since the Oscars, which is
that's incredible.
A giant thing. And I'm not trying to, shill for Disney here. I'm just saying that when we were all locked in, being able to sit around for a few minutes and, sing some Disney songs was a lot of fun. I think a lot of other families were thinking the same thing.
That's exactly right. It's sort of, people are talking a lot about mental health and being able to, maintain these connections to their family members. And this is all a huge challenge. And, I will not shy away from this. Like, I have a grandmother who lives in an assisted living facility, and she's in her mid 90s. And this has just been such a difficult thing for us to go through as a family as well. We all are experiencing this. Whether we're an elected official or not, whether we're a famous person or not, everyone is experiencing these challenges, with regard to staying in touch with their loved ones and keeping a semblance of normal in their lives. And, whatever we can do, whether it's, through these, through, Disney and ESPN doing a great job of creating these moments, or, whether we can all grab a cup of coffee together on Zoom as like friends and just chat with each other. I've stayed in touch with girls that I went to high school with that, we see each other maybe once or twice a year, but we've been, frequently hanging out on Google together.
Yeah.
And I think that's one thing that is something that's positive that's coming out of this, is that we are all taking concerted efforts to continue our personal connections with our friends and neighbors.
I think, yeah, that's obviously, I don't want to be too much of a Panglossian optimist here, but there is a sense that when you're going through this, being able to feel those community ties to people around you is a big deal. My wife and I have talked about how, being in Madison Heights over the past couple of years, we've made friends in the community, and, that's helped us really sort of stay strong through this, is knowing that there are people around us that we can talk to and reach out to, and kind of lean on a little bit.
Exactly.
So I'm going to start winding down a little bit, but we're looking at another about 10 days, the governor's executive order, the shelter in place order, I think will lapse. And so then that's the next point at which you as a legislator are going to probably have to wind up going back to Lansing to talk about the next steps. What do you think is going to happen? What's the next phase here for you or for the legislature? How are we going to kind of wrangle through this next phase?
Yeah, that's a great question. So as you sort of alluded to earlier in our conversation, you can't just like turn the economy on with a light switch, just like we can't as we have already talked about Disney, I can't wave my Sorcerer Mickey wand and make the virus go away in one day. If I could, I would. But it's not going to be any like less dangerous on April 30th as it is on May 1st. There isn't like some magical drop dead date that things are going to change. And so, one of the things I know we're going to be looking at as legislators, and then I'll talk about something I know we're going to look at and something I hope that we're going to look at. So the first thing I know that we're going to be talking about is the House Republican plan to reopen the government, which you can follow me on Twitter at Mari Manoogian to see some of my thoughts about this. But I will say a couple top line things that have already frustrated me is that it is a regional plan, quote, regional plan to reopen the government or reopen our economy, where the focus is on keeping Oakland, Wayne, and Macomb and our sort of Southeast Michigan area, quote, locked down, and then opening everything else up. And through some of the comments we've talked about here earlier, Vaughn, I mean, it's obvious to me that this is not a plan that's tenable. And if we look at the data and we use the information that's available to us, we can also see that the number of coronavirus cases is actually decreasing, albeit a little bit slowly, but it is decreasing here in Metro Detroit. However, in these rural communities, the number of cases is actually increasing. So this is not a strategy that I would be supportive of. And I think that we need to start having some very serious conversations about what the future of the economy looks like here in Michigan going forward into the summertime and into the fall. But this plan is not a serious plan. And the final thing I will say about it being completely unserious is that it doesn't have any protocols for testing in it as well. And there in any of the steps that are outlined in this plan, there's not a single point that talks about how we're going to procure more tests and where we're going to do that testing. And any plan for reopening the economy needs to have that. The thing that I really hope we're going to focus on is actually House Minority Leader Christine Gregg's plan to have remote voting during this pandemic. While I'm a huge proponent of making sure that folks are in attendance during session and that I believe that we do our best work when we are in person, there are times when the public health situation precludes us from doing so. And Minority Leader Gregg has developed a set of rules that can be adopted by the legislature to ensure that we're able to keep the lights on and continue working and have committee hearings and continue to hold session even when we are remote. There are other states that have already done this, and it's my hope that Michigan is able to follow suit.
Yeah, when we had our conversation with Representative Koopa a week or so ago, one of the things that she talked about is that when you guys were called into session, it wasn't, because of the need for social distancing, it wasn't the sort of thing where, like, there was floor debates and, discussions. Right. It was a very, very regimented sort of a session where she went in, pushed a button, and that was it. It does seem like that seems kind of not like the sort of thing where you really need to compel attendance if you're not getting the associated stuff with it. There are other ways to do it, even more secure.
It was very frustrating given that it was procedural. I attended as well because I thought it was important for our district to be well represented when they were taking attendance and when this vote was being taken. However, it was incredibly procedural. I literally showed up, presented that I was in attendance, and I left. It was a voice vote, and it was being voted through on acclamation anyway. And so there was no floor debate, and there was no public in the gallery. This was not. It was not session as you would normally expect it to be.
Well, and again, it seems like sometimes that there's a resistance to changing things or trying things a different way that's based more on just, I don't know, resisting any kind of good idea than it is about trying to figure out what the best practice should be moving forward. So
yeah, it can be a challenge. Change takes time, right? It's one of the most frustrating things about government for our constituents and even for us in these positions is that making change takes time and building consensus takes time. And it's my hope that, because of the nature of the situation that we're in, that we are going to be able to, really buckle down and get something done here for other people.
Great. Well, with that, I kind of want to say thank you, Mari. It's always a pleasure to talk to you. I'm sorry.
Absolutely.
Breakfast or something, but hey,
yes.
life.
Maybe when this is all over, we'll be able to grab breakfast soon.
That sounds exciting.
Excellent.
But hopefully for all of you out there watching, hopefully you've enjoyed this video. Hopefully you're enjoying the work that we're doing here. Trying to keep you all up to date with what's going on in Lansing and around Oakland County. If you are watching this all the way to the end, thanks a lot. Please make sure that you follow us on Facebook. Check out our website, ocdp.org. Make sure you're on our mailing list. And one of my favorite things to throw in here is that if you would like to see more content, number one, send us any ideas you have on people you'd like to see us talk to. We'd love to hear from you. And, chip in a few bucks. Try and give us, we have actually seen, and I'm super excited about this, some nice recurring donations that have started coming in since we've been doing these videos. And that's exciting because I think it's a good relationship builder for us and the community. So if you can chip in just a few dollars, $2, $3, $4, $5 a month, that you can commit to donating to the Oakland County Democratic Party, it means that we can do more work like this, get more posts like this out into the community, and really start giving you guys the ability to hear more from us, hear more from the elected officials around you, and also, and this is totally my fun little point of privilege as a Democratic Party official, means we'll be able to get more Democrats elected, and it does make a difference. It means that we have people like Mari who are in office who are able to respond to this and are able to do that constituent work and take care and make sure that people in their communities are getting the help that they need. So thanks again to Mari. Thank you for being here, and thank all of you for watching. Take care, stay home, stay safe, and I will see you again later this week.